Hi everyone, welcome to this Youth Mental Health Community of Practice webinar on the Productivity Commission and Victorian Budget Analysis, a Youth Mental Health Perspective. My name is Emily Unity. I'm a young person of lived experience and I will be your MC today. I would like to start by acknowledging the traditional custodians of the lands in which we are presenting and attending today. I'm originally from the land of the Noongar Whadjuk people, but today I'm meeting with you in the land of the Wurundjeri people of the Kulin Nation. I'd like to pay my respects to elders past, present, and emerging, and acknowledge that sovereignty has never ceded. Today's webinar will focus on recent policy developments that have significant implications for the youth mental health sector and those who work in and alongside it. We will firstly hear from a number of the Orygen policy team about some of the key findings in the report. And then we will hear from Seb Antoine at YACVic about some of the major youth-related announcements in the Victorian Budget, and particularly those related to youth mental health. We'll then open up with the webinar to comments and questions from the audience and have a group discussion. This webinar will go for about 90 minutes, with the first 60 minutes dedicated to presentations and the final 30 minutes reserved for questions and discussion with the audience. Attendees are welcome to attend either the full 90 minutes or just the first 60. A reminder that this webinar is part of the Youth Mental Health Community of Practice. Co-convened by Orygen and YACVic, the community of practice brings together a network of young people and those who support them to learn about and drive change in key policy and practice areas of the youth mental health system. The community of practice holds regular events to share information, facilitate learning, and create connections across the youth mental health sector, as well as other sectors that have a role to play in supporting the mental health of Victoria's young people. If you're interested in joining the community of practice, please accept the invitation that will be emailed to you following this meeting. Before we get started, if you have any comments or questions for the presenters, please use the chat function at the bottom of your Zoom window. We will address these questions at the end of the presentations. Our first presenter today is Viv Brown. Viv is the Associate Director of Government Relations and Policy at Orygen, a role in which she oversees Orygen's government relations, advocacy, and policy work. Today, Viv will be providing us with an overview of what the Productivity Commission's final report has found and recommended regarding young people mental health.
Great, thanks Emily, and lovely to be here. Nice to see you all. I'm just going to share my screens. I do have some slides. Apologies for that. It's just a little bit to get through. So I just want to check that everyone can see those. Andrew, thank you very much. Excellent. So I just thought today what I would do is provide a very kind of high level overview of the final report of the Productivity Commission into Mental Health. Thought maybe it might be worthwhile just sort of taking a step back first, just to sort of describe what the Productivity Commission is and what their function is. And then just to describe a bit more about what the focus of the inquiry into mental health was for the Productivity Commission and the process that they undertook to produce this final report. So if you just bear with me, I'll flick through. So look, just in terms of what the Productivity Commission is, for those of you that haven't sort of come across it before, it's the Australian government's independent research and advisory body. So it provides advice to the Australian government, but also other governments and I guess the broader services and social services systems on a range of different economic, social and environmental issues that are affecting Australians, both their productivity, but also importantly, it has a look at the impact of these issues on their welfare as well. So the outputs of the Productivity Commission are really quite significant. So they produce a range of research and working papers on a broad range of topics. They conduct ongoing reporting on Australia's productivity, and they also report on the performance of a number of government services as well. So we've got quite a high level of standing and a high level of importance within government itself. In terms of some of the research papers that are developed, I just thought it'd be worth taking a sidestep and just noting a couple that you might be particularly interested in that they've released this year around July. There was one research paper that looked at why the incomes of young people in particular had declined over the last 20 years. So not increased, not stagnated, but actually declined. And another paper related to the challenges for young people in Australia at the moment in climbing the jobs ladder. So There's a couple of really interesting reports I recommend you having a look at, and they are being sort of used and discussed in a lot of sort of commentary and advocacy at the moment, particularly related to COVID and the impacts of that on young people and their future kind of career and job prospects. So I'd recommend, when you're looking for opportunities to advocate for changes to government policy, service delivery and funding, that you do access the Productivity Commission reports and research, because they are a highly regarded and an independent source of information. So the Productivity Commission also run public inquiries. So that's a way for the broader community and all stakeholders to actually have an opportunity to provide their comments, their experiences and their opinions into particular issues. So I think we were really fortunate that in 2018, the Productivity Commission was tasked with a review of mental health in Australia, and that was an inquiry process. So obviously opening that up for very broad consultation. Some of the commentary, I guess, early on when the inquiry was announced, was that people recognised that mental health services and the mental health sector had been subject to an extraordinary number of inquiries, commissions and reviews over the last 15 years. That people were reflecting that, you know, a number of the recommendations of these reports and reviews hadn't actually been actioned yet. So there's a question there, I think, quite legitimately, as to how this was going to be different and what this was going to achieve. But on the other side, I think even the sort of cynics amongst us saw that there was a lot of hope and optimism to be had in this Productivity Commission inquiry. There was an opportunity here to sort of look back on all of those reviews and recommendations to sort of see what was still relevant and pertinent right now, to re-prosecute them, to build on, I guess, the political will that was obvious even in the fact that the Treasurer announced and tasked the Productivity Commission with looking deeply into this issue around mental health in Australia, and also to sort of seize on the public momentum that was building through the, you know, increased conversations, the decreased stigma around mental health issues, and sort of the increased demand now from the general public that there needed to be a much stronger response. And I think there's a couple of really distinguishing factors too about the Productivity Commission looking at this that were new and different from other reports. So one of those features was that the Productivity Commission were going to look at this issue through an economic lens rather than a health lens. So the remit of the Productivity Commission was to examine the impact of mental health on people's ability to participate and prosper in the community and the workplace, and the effects that mental ill health had more generally on the economy and on productivity. So this was a new way of looking at these issues. And I've just sort of taken from the first paper that the Productivity Commission put out around mental health issues paper in 2019, I guess the sort of number of domains and how broad they were looking at this through an economic lens. So they were looking at resources expended on health and human services. These are quite tangible things to measure and look at in terms of what's being expended on diagnosis, treatment, recovery, what's being spent on other services and supports that might be impacted by an increased number of people accessing these services due to some of the impacts of mental ill health it had on their lives, like housing, justice and social services. They were looking at the costs, more voluntary and the informal costs around, you know, the hours and the support that were put in by families and loved ones and friends for individuals. So that's one domain, and that's quite sort of tangible and realistic to look at. The second one was looking at things like the reduction in incomes and living standards resulting from mental ill health experiences in Australia. So lower economic participation, people having increased barriers to accessing paid and gainful and meaningful employment because of mental health issues, lost productivity. So even if they were engaged in employment, they may not be as productive as they potentially could be if they were experiencing good mental health and good well-being. So they might be having more days out of role due to illness. That there was costs on collecting taxes to provide for other services then as a result of those two earlier domains. And then there was also these really significant but slightly intangible and hard to measure costs, but was certainly considered in the Productivity Commission review. So, you know, what's the cost of lower social participation and community connection for people experiencing mental ill health? What's the cost of the pain and suffering that they're experiencing and their families and friends and support networks? And what's the cost of stigma and discrimination as well? So it was a really broad lens. And I think, again, given that the government was the ones that were undertaking this work, and the government wanted to understand what the real true costs were of mental health and what the costs and benefits were of doing better in this space, we really had a great deal of hope that this report would have a particular impact and result in some significant reform and change. And then the other area that was really interesting and unique to this approach, I suppose, was that they took a broader focus. So they looked at mental health and the solutions and the opportunities to improve and make changes beyond health systems. So they went well beyond health and took their inquiry into investigating what could be improved and changed or enhanced in a whole bunch of other domains, in education, in housing, in income support. They looked at things like sports and activities and arts and music and culture, and really recognised the protective and promoting aspect of these aspects of our lives in terms of supporting Australians to experience good mental health and wellbeing. So they sort of, I guess, essentially in looking at it in this way, what they did was put individuals at the centre. They didn't look at this from a service or a system perspective and what tweaks need to be made in the system. They took it right back to look at what how people, Australians and also young Australians were experiencing their mental health and wellbeing and all those other domains and aspects of their life that they think made a difference to either putting them at greater risk of poor mental health or actually promoting good mental health. So, and then they were able to shape up a whole range of recommendations and actions that actually talk to all areas of government, all levels of government, all service systems, providers, and also the broader community, so that we all recognise the role that we could play in reducing the individual social and economic costs of mental ill health. So it's a great opportunity. The process was a significant one as well. It went over nearly 2 years, I think, from start to finish. So back in November 2018, the Productivity Commission released its terms of reference. So we knew just how broad the scope of this inquiry was going to be. They also appointed 3 commissioners, Stephen King, who's a professor of economics, Julie Abramson, who's a lawyer and also a public policy professional who worked in areas including economic regulation, and Harvey Whiteford, who's a professor in population mental health. And once they were announced, the first thing that the Productivity Commission did was put out an issues paper in January 2019. And then they started to listen to people, and they listened to a lot of people. So this inquiry had probably more engagement than any other Productivity Commission inquiry in its history. The one that came close was one on disability services back in 2011, sort of predated and sort of precursor to the NDIS. But, they had 564 pre-draft submissions. So once the issues paper was released, 564 individuals and organisations took the time to put in a comprehensive submission into what the draft report should say. After the draft report came out, another 680 individuals and organisations provided comment on that draft report. So it's really significant. And that's just a written submission. So, just from being in this sector for the last couple of years, it couldn't go to a sector forum, a peak body event, or any sort of mental health sector engagement activity where we probably didn't see at least one of the commissioners of the Productivity Commission there listening and talking to us. So that was really a commendable process, I think. The final report was then provided to government on the 30th of June this year, and then the government had 25 sitting days to consider that and release it. So obviously due to COVID, we had a number of those sitting days which didn't happen. So it took a little longer than expected. So we waited a little bit longer, but on the 16th of November, the Prime Minister delivered a mental health speech at Orygen, so that was amazing. There's Emily in the photo with the appropriate face mask covering and everyone social distancing. And the Prime Minister in his speech then announced that the Productivity Commission report had been released, which was great news. He also announced a few funding measures at the same time, but essentially signalled that the government was going to respond in full to the Productivity Commission report in the May budget. So now we're in a process here where we're starting to look through the recommendations and finding and utilising what the Productivity Commission found as an opportunity to advocate for what's needed in the next budget. So it's going to be a busy couple of months. And look, just the headliners, I suppose, from the Productivity Commission, it did take an economic look at this. So it found basically that mental ill health costs a lot of money. It's $200 billion a year. This is extraordinary. 151 billion of that in diminished health and reduced life expectancy. So the economic case is undeniable. Yeah, they broke that down even to looking at that on a daily basis of being around 550 to 600 million a day, so significant. What the Productivity Commission did in its final report is outline a series of priority reforms and recommendations and then actions. They costed out all of those reforms. They thought they would cost between 3.5 and 4.2 billion a year to deliver, with up to nearly $20 billion worth of savings from these reforms, and most being, again, in increased quality of life for people. So we undertook an analysis of the report. It was 1,600 pages long. I did not read all 1,600 pages, but amongst all of our team at Orygen, we certainly tried to get across as much of it as we possibly could. There were 24 recommendations in the report and about 103 different actions. So there's lots of really great stuff in there, lots that we strongly support, and lots that actually align really well with the submissions and the recommendations that we had made along the way, which is great to see. One of the priority reform areas is around early intervention and prevention. That was a strong focus, again, not surprisingly, with an economic lens. They're saying the more you can prevent mental ill health onsetting in the first place, or nipping in the bud as early as you possibly can, the better the economic gains are going to be later on down the track. So I can't say that we necessarily support everything though as well. That's probably important to say, but what we are keen to do now is concentrate our future activity in government relations and advocacy on the strengths of these reports and a number of the specified actions which our organisation believes is going to make a really significant difference to the lives of young people in particular. And so I'm just going to quickly run through some of these, but the rest of the team will talk to them in a bit more detail. One is around scaling up individual placement and supports of vocational services in community mental health services. This has been something that Orygen has been pushing for a long time. So we were really glad to see that in there. And also that the recommendation recognised that young people have some specific needs and that these programs need to support educational engagement and pathways, as well as getting them a job placement, which historically been the focus of that program. There was lots of focus on tertiary education in the report too, recognition that there was not enough necessarily being done in a systematic and coordinated way in tertiary education, that every tertiary education provider needed to have a mental health and wellbeing strategy going forward. So that was great to see. Lots of support for the peer workforce, which my colleague Nick will talk about shortly. Obviously support for universal aftercare for people following a suicide attempt, supports for families and carers, which my colleague David will talk about shortly too. An expansion of supported online and digital supports is in there, which we strongly support, although we really encourage them not just to be seen as low cost, low intensity services. The online platforms have lots of efficacy and value in tertiary mental health services as well, and working with young people through to recovery. So we'd like to see them included there. And also some recommendations around better integration of mental health and substance use in planning and commissioning and service delivery. So there was lots of really good things in there, and I guess those points that I've just outlined are things that we will be going to governments in successive budgets in the next couple of years, and trying to continue to advocate for their uptake. So I think that's probably enough for me, if that's okay, and I'll hand back to Emily and the rest of the team to talk in a little bit more detail.
Thanks so much, Viv. I feel like the Productivity Commission report was sort of like a black box to me until recently, and you've really provided a fantastic breakdown in terms of the purpose, the process, and the outcomes of the report. I think we all know the inherent costs of mental ill health, but this type of like concrete data from an economic lens really presents a very exciting opportunity for policy and advocacy work and creating change at a government level. So thank you again. Our next speaker today is Cameron Boyle. Cameron is a senior policy analyst at Orygen, where he develops evidence-based policy documents across a range of issues related to youth mental health. Today, Cameron will be discussing the findings and recommendations in the report related to vocational supports and housing and homelessness.
Thanks very much, Emily. I'd have to head off as well in about 10 minutes, so I'm sorry I won't be around to answer any questions that might come up, but feel free to still put them in and I'll respond to them after the webinar is finished. So as Emily said, there are two main issues that I'm speaking about today. The first one is around housing and homelessness. So the Productivity Commission recognised the impact that housing insecurity and homelessness has, as it is a wide-ranging issue in Australia. About 1 in 200 people on any given night are likely to be experiencing homelessness or housing insecurity as such. And of that population, about 25% are young Australians. So there's a need to respond to it, and the Productivity Commission has put in a few recommendations around that. The primary recommendation that they've put in place, so recommendation 20, requires that governments look into the shortfall in place of supported housing stock. So the Productivity Commission has previously noted that it would require an expenditure of up to $700 million a year to address the shortfall in housing stock. However, without sufficient housing available, it's going to be impossible to respond to the issues of housing insecurity and homelessness. This will require obviously quite a dedicated response from governments over many years, but it's encouraging that the Commission has recommended that. But their priority recommendation in this space is actually quite narrow, and it's centred around preventing exits into homelessness from institutional care. This is a relatively significant issue because it's been estimated in the past that about 7% of people who go into mental health care settings won't be assisted with their transition exiting from healthcare and won't necessarily have somewhere to go. This is a huge risk for experiences of homelessness. So the Productivity Commission recognised that and stated that care institutions around the country need to have a policy in place that prevents people from exiting into homelessness. The second major topic that I want to talk about today is around the individual placement and support model, better known as IPS. So Viv noted that that was one of the key recommendations coming out of the Productivity Commission, and indeed it is. So recommendation 19 is the relevant recommendation, and it's stated that as a priority, governments acting to extend the IPS model beyond its current limited application. This is very encouraging because IPS has primarily been provided at headspace centres around Australia, and through various budgets, it's been expanded now that 50 headspace sites will be trialling the IPS model. However, IPS has largely been limited to these headspace centres. So the Productivity Commission is providing that it be expanded to more community mental health care settings. And that is a reflection of the evidence supporting IPS and its utility in helping young people of all ages achieve employment and or vocational education and training. I think that probably wraps me up.
Thanks so much, Cameron. I really liked how you highlighted the different intersectionalities of young people's well-being, because I feel like it will encourage more collaboration across different sectors and services. The point about preventing exits into homelessness after institutional care, I think is really important and something that I feel like might have been missed previously, but it's nice that it's really being focused on now. Because I feel like my experience in mental health services is that it's been much more focused on like that crisis care within the institution and not so much what happens before or after. So that's really exciting. Thanks. Our third speaker today is Nick Faber. Nick is a policy analyst at Orygen, where he provides research support to the policy team and assists with projects that focus on partnering with young people for better outcomes. Today, Nick will be talking about the findings and recommendations in the report related to peer work.
Thanks, Emily, and good morning, everybody. Today, I'm going to be talking to you about what's in the Productivity Commission report that involves peer work, which I know a bunch of us are very passionate about. already, but for those who aren't aware of the peer workforce, there are a workforce of people who are trained to share their lived experience with people entering or accessing mental health services, and particularly in youth mental health services, that will be people with a lived experience of mental ill health and people who share a similar age range of the people who come into a service. So really broadly, I think the Productivity Commission report was quite positive on the peer workforce as a whole, which shouldn't be a surprise. All of the state and territory mental health plans or similar government documents have been really pushing for the more support for the peer workforce for the, particularly over the last decade. In general, I think the Productivity Commission highlights the different contexts that the peer workforce might be better utilised in and useful for. So they talk about the broad range of things that peer workers can do in things like perinatal mental health or in group work or for people experiencing psychosis. So it did a great job of tackling the range of different things that peer workers can be involved in. It also was quite promising in that it talked about peer work as a source for cultural change of the mental health system and the workforce. I think sometimes we get focused on the peer support element and forget that there is a cultural change element as well, when services benefit from hiring people in the lived experience workforce in that way. And it also covered some of the really well-known issues that the space has known about for a long time, such as insufficient recognition of the value of peer workers by services or other staff, inadequate supervision and support for peer workers, poor professional development and career advancement, and the absence of a representative professional body. So one of the recommendations, recommendation 16, talks about the Australian government providing seed funding for to develop a professional association for peer workers, which is very exciting. It's something that has been talked about for the last few years. The National Mental Health Commission commissioned a report called Towards Professionalisation, which was about the peer workforce, and that was one of their key recommendations. And it's something that Orygen have asked for as well. At the moment, there is no national body that represents the interests of peer workers or can provide consistent guidance and advice for the peer workforce across Australia. So we think that's a really exciting ask. And we do have some, the only thing I would add to that is there are some youth-specific peer work issues, mostly related to a workforce that ages out of their role. And we do hope that professional body is able to tackle some of those youth-specific issues and provide some youth-specific support in addition to what they will hopefully be providing. There's also a recommendation for better after-hours care or hospital emergency department alternatives. And one of those recommendations talks about peer and clinician-led after-hour services and mobile crisis teams. So again, just highlighting some of the ways in which peer workers can be involved in the mental health system. And there was also a mention of carer peer workers as well, so providing better support and supervision for carer peer workers within mental health care services. So obviously that's people who have an experience of caring for people with a lived experience of mental ill health and providing care for other carers.
Thanks so much, Nick. I think I'm quite biased because I'm a peer worker, but it's super exciting to see that the Commission was really supportive of peer workers too. I really liked how you reflected on the potential cultural change that peer workers can have, because I think that integrating lived experience more into mental health workforces can keep services relevant and focus on the voices of our young people. I also, I didn't know about this, but like the potential professional association of peer workers is like super exciting, because I think it's a sentiment shared with my colleagues that peer work is often like very unclear without any definite career pathways or training. So it's nice that that's in the works and potentially formalized as a career. So thank you again. Our fourth presenter today is David Baker. David is the Principal Policy Advisor at Orygen, a role in which he works with the policy team to translate clinical youth mental health research into evidence-informed policy opportunities for government. Today, David will talk specifically to the findings and recommendations in the report related to family support and alcohol and other drug use among young people.
Great, thanks, Emily. Before I start digging into the details that the PC report had on those two topics, I just thought it's worth mentioning that on such a long document, and the amount of work they've taken on to deliver this report is astounding, but it's really patchy and consistent output around the actions they identify. And one of the problems with these big overarching strategy documents is the lack of detail in the directions to go forward. Lots of reasons why, lots of evidence why, and lots of stories why, but a lack of details in some of the actions on how to move forward. And alongside that lack of details is, I think, often a lack of recognition of the support or resourcing that's needed to implement them. And I know Seb's going to be touching on the Victorian Budget coming up, and the Victorian Budget's got the double whammy of the Royal Commission coming as well. But it's really important that it's understood that making these big changes requires money and it requires people working on the ground. And so just as you're working through the issues that are particular to yourself or your organisation and relying on the PC report for your advocacy or policy work or other work, just think about how you can extend the work of the PC Commission, because everybody who's got knowledge on particular areas can bring more than the PC was able to put in this report. And that's a little bit of what we do at Orygen, and I'll touch on that with the families topic that I'll talk to now. The PC report widely recognised the issues that families face, but also the important role that families can provide for young people who are experiencing mental ill health. And they also recognise that this has to balance with the young person's own preferences and the family's wish to be involved. And there's a really tricky role for the clinician, and that's supported when there's a family peer worker or a family worker to negotiate those different preferences between the young person and their family. And what the PC report also recognises is that, as well as increasing the inclusion of families in mental health services, you need to increase the support that you provide for them, because the PC recognised that a young person's mental health can impact their family as well, and the stress that they experience, be in their own work or school participation, within the relationships within the family, but also reduce time or energy for social activities and support, which they need to bring the energy for themselves to support a young person. And it's really important to recognise that family inclusive practice is a partnership between families and mental health services. There were 3 actions in the PC report that focused on the role of families. One was around family inclusive practices, and the PC recommended that MBS rebates be provided for family interventions, and also that state and territory governments develop workforce capacity to implement family inclusive practice. And so the MBS is great, more funding for services to include families and the role of family interventions is great. That point about state and territory governments develop workforce capacity, that's an example of where there was a lack of detail. Each role needs, position descriptions. They need to have organisational change to see how that new role will fit in the organisation, what changes are required in the culture or the practice of other people in the organisation. And that's a lot of work for an organisation to take on, and it's big work for state and territory governments to add to workforce strategies. Orygen last year or earlier this year put out a second family inclusive practice paper, which included some program logic around implementing a family peer work supporter role. And it was very high level, but it still had 7 or 8 stages and 6 different levels of implementation, and that was for one role. And while I appreciate the PC report can't go into that sort of detail, it needs to acknowledge what is required to actually implement the actions that they identify. Another one they had was action 18.2, which is around family support services. And again, they allocate responsibility to state and territories. It's great to have that demarcation to know who's responsible for planning and funding. But again, it goes into the same issues of workforce training and organisational policies and procedures. And so it's really important, and I'm banging on about this a little bit, but it's really important that it recognises just what's involved in making these changes. One thing that was missing from the PC report around families was a focus on siblings, the experience of siblings, and also the roles that siblings can play in supporting their sibling who's experiencing mental ill health, and often can reach a sibling in the way that parents or carers or adults may not be able to do. Again, Orygen have done some work in developing policy solutions around trialling a sibling peer worker role that would address some of those particular issues, like a family peer support worker role comes from an adult perspective. And again, if a sibling is, not having a great time with a parent or a carer, then they're going to want to talk to someone their own age or someone who has had a similar experience. And that, again, can differ from that of a peer worker role whose lived experience of mental ill health might mean that the roles don't meet their need of that sibling. The other area that I'm talking on about is the PC's focus on alcohol and other drugs. Now, this is an area that got a lot of attention, and rightly so, because the co-occurrence of alcohol and other drug use and mental health is quite high, but also so are the potential effects on mental health, but also physical health and functioning and lifetime outcomes. Among 14 to 24-year-olds with a mental illness, they're likely to smoke at rates of 2.5 times that of their peers. Their illicit drug use is up to 1.5 times greater, and riskier alcohol use is higher as well. And as I mentioned, these have poor impacts on poorer lifetime outcomes for education, employment, and physical health, and not just their mental health. The recognition of the role of alcohol and other drugs and how it interacts with mental health has been, and the need to address that in services has been identified for quite a long time. There was quite a lot of progression around dual diagnosis guidelines 10 or 15 years ago, and it was recognised in all strategy documents that there's a need to address these together. In a couple of states, such as Queensland and Western Australia, they've made steps to integrating it. So the strategy document covers on both areas. But if you flip through those strategy documents, it still has on one page mental health, and then on the facing page, alcohol and other drugs. The goal or the ambition in policy documents to integrate services is a great rhetoric, but the challenge is immense. It cannot be understated how big the challenge is to get two sectors that have operated independently and that are largely funded independently, and that have largely have different qualifications for what you need to work in those sectors. Getting them to work together is a great goal, because it will provide a greater integrated service experience for young people. But the emphasis there is on the experience of the young person in the integration of the service, how they experience moving from one organisation to another, or within an organisation, or how well they're referred, and how they're supported in making any moves between services. What happens behind that? What happens in how services work together isn't their business. They just need to have that smooth integrated service experience. It's up to organisations and services and state and territory health departments to work out how that's going to happen. And differences across jurisdictions mean that it's going to happen differently in different states. And the PC report, I guess, it recognises that integration hasn't occurred, but there wasn't a lot of detail on how that could happen, rather than blanket statements that we've seen in the past about how services should be integrated. So a key step is to have joint development and an implementation of operational guidelines. This is one of the key findings in the PC report in Action 14.2, because that's a chance to move beyond the visions and get to that point of making change and enacting integration. We're currently working on some policy solutions in this area, and while they won't come out till later next year, we've been surveying people who work in alcohol and other drug services and mental health services. And a couple of early findings were that, let me find my notes, referred to the model, there was the idea of whether a model would be best if it was separate services or integrated services. And overwhelmingly, people thought that if you're able to deliver both services in one, then that was a better outcome for young people. But at the other hand, at the same time, people are largely working in separate organisations. And so it just illustrates the transition that's needed to move to that integrated service experience is quite large and is going to need a lot of resourcing and a lot of support to make that step. Thanks, Emily. Thanks
so much, David. I really liked how you reflected on family inclusive practice, which is something that I'm particularly passionate about. As I often feel like young people have been traditionally and historically treated as if they're like in a void, away from their family structure, and vice versa too. Like some families have been left out of a young person's care. And I feel like things like family peer workers and sibling peer workers too can change that. I also really appreciated your candidness about the lack of detail and the directions to go forward in the report and specific recommendations about the resources needed to make these changes. Because I think that it's great that the PC has come out with this report. It's super exciting. But I definitely echo your sentiment that it's not an all-encompassing solution and that we can all use this as a good starting point to advocate for more change. And I hope it encourages more collaboration across our different organizations. So thank you. Our final speaker today is Seb Antoine. Seb is the Policy and Research Officer at YACVic, where he elevates the voices, experiences, and solutions of young people and the youth sector to decision makers. Today, Seb will be providing an overview of the measures in the Victorian budget which relate to youth mental health.
Fantastic. Thanks so much, Emily, and thanks for joining us this morning. As Emily said, I'm the Research and Policy Officer at YACVic, zooming in from Wurundjeri country, which always was and always will be Aboriginal land. Now, I'm going to throw a whole bunch of numbers at you today, which represents the government's investment in a whole range of initiatives. I want you to know that you don't have to remember the numbers, because what I'm doing is in the chat putting a link to our website where we pick out the really important initiatives that the Victorian government is funding. So I'll say them, but they can just go in one ear and out the other. So yeah, as Emily said, I'll be giving a bit of a rundown of the Victorian budget, which came out last week on the 24th of November. It was far shorter than the Productivity Commission's report. It was around 400 odd pages. I've read most of them, but not all of them. And we'll talk about the most important bits today for young Victorians' mental health. We think the budget is a really strong foundation for supporting young people and supporting Victorians more broadly to weather the kind of impacts of COVID-19. And as we've mentioned before, the context is really important. So we've had the Royal Commission into Victoria's mental health system. The government's committed to implementing all of the recommendations. The interim report came out, 12 months ago now, with a whole set of recommendations, and this budget is implementing those. And what we know will happen is, as the final report comes out, the Victorian government will, set aside money to implement those recommendations as well. So the budget sets out what the government's going to spend their money on for the next few years. We think that demonstrates that they're actually listening to young people, which is very exciting, and it demonstrates a commitment to creating a fairer Victoria. From the 300, 400 pages, there is some detail lacking in the way that these kinds of initiatives are going to be implemented, but I don't think that's necessarily a bad thing, and I think it means that there's still space for those kind of mechanisms to be designed. And what we'd love to see is for young people to be involved in the design, the implementation, the monitoring and evaluation of all of these kinds of initiatives that the Victorian government are spending their money on. So I'll talk firstly about the mental health initiatives, and then talk about some of the other domains that we know are totally interconnected. And, you know, the government spending in those domains will definitely support young people's mental health. So overall, there's $868 million set aside for additional mental health investment to help implement those interim recommendations from the Royal Commission. $21.4 million amongst that is to complete the statewide expansion of the hospital outreach post-suicidal engagement, or HOPE service, which supports young people, carers, families to identify and build kind of protective factors. And this was one of the key recommendations from the young people that we spoke with, to have that kind of ongoing support. There's $16 million for a lived experience peer workforce, which is really exciting and something we've been talking about amongst this community of practice for the past few months. And that money will go towards training and opportunities for employment. Again, there's no necessarily detail around, you know, peak body, which is part of the conversation before, or representative group. But, you know, we'd love to see that happen as well. There's $7 million for Orygen to continue doing their amazing research into, you know, youth mental health in Victoria, or in Australia broadly. And then they've earmarked $47.8 million for early intervention support for young people. We were joking before that we don't actually know what this means yet, which is, again, not necessarily a bad thing, but something for us to keep in mind in our, you know, advocacy and research and campaigning. So, yeah, all really amazing things, we think. But yeah, we'd love to see young people be involved in the design and delivery of these investments. So turning towards the kind of interconnected issues, firstly, jobs. There's a massive spending on the employment sector. This is not just for young people, but for everyone in Victoria. So there's, you know, $800 million for a new jobs tax credit, $620 million for a Jobs for Victoria program, including $150 million to hire women. We're keen to see more information on this, about how it's going to be implemented as well. Around $150 million for subsidised or free training, money for apprentices and trainees on government infrastructure projects, and $12.7 million to support people on their career paths into the mental health sector. So I think this kind of spending in jobs really recognises the effects of the pandemic and how it's, you know, really impacted everyone's employment, but particularly young people's employment, and as well the kind of very close connection between unemployment and underemployment and young people and everyone's mental well-being. Turning to education, there's nearly $25 million, so public school students can keep their kind of school-owned devices, which I think is really exciting, because as well as being able to use them for schoolwork, they can use them to access the digital mental health supports that you know they might need. And we think this is especially important for rural and regional young people who've told us that an in-person support might be, you know, an hour's drive away or inaccessible really by public transport. In terms of access and inclusion, there's nearly $40 million to continue delivering respectful relationships in schools, which is a really great program that promotes respect, positive attitudes and behaviours amongst young people. A small budget line, but I think a very interesting one, is $1.4 million to deliver an anti-racism strategy. And the context of that is the increased kind of race-based and religious-based discrimination that's happened, particularly around COVID, but just generally. And, you know, recognising the connection between those kinds of experiences of racism and young people's mental health. In terms of housing, you would have known that they've invested over $5 billion over the next 4 years in delivering 12,000 new social housing properties, which is, you know, massive, and the kind of first kind of investment of that size in social housing in decades, I believe. And what we're really keen to see is that young people who need social housing can access it, because we know that the current model doesn't quite work. It indirectly locks out young people who, you know, when they put their name on the social housing list, just end up at the very bottom. And many of the people we talk to don't even put their name on in the first place. There's also $75 million to expand the home stretch initiative for all young people in care, which means that young people in state care can be supported to stay with their foster parents or in supported accommodation till the age of 21. Moving to the youth sector, which we think is really important in terms of early intervention and prevention. So there's $28.5 million to expand existing supports for wellbeing and mental health of students, of high school students. So that's the Navigator program, Lookout, Headspace mental health training, and mental health practitioners in schools, and around $4 million to deliver specific youth work programs in like particular areas. So Latrobe, Warrnambool, Swan Hill, Morwell, Ballarat, and another couple of programs specifically working with Pacifica young people, and then with 5 Aboriginal communities, which is the Marram Nam project that is co-delivered by YACVic and the Koori Youth Council. So we think all of this investment is fantastic, and it is a really important first step in supporting young people in Victoria, everyone in Victoria, weather the impacts of COVID-19 and the pandemic. What we'd love to see next is more investment in generalist youth work programs to deliver that early intervention and prevention work for young people, particularly in rural and regional areas where access to like specific mental health support might be lacking, and trusted referrals as well for that. What we've heard from our members is that the demand has increased, so youth workers are seeing more people than ever before, and you know, they expect that to continue over the next 5 to 10 years. And what we're also thinking about is the number of young people who, before this pandemic, might not have ever needed to access services, and now, because of the complications and the impacts of the pandemic, will need to. So how do they know where to go? How do we reach those young people before things spiral out of control? What we'd love to see as well, like there's so much money towards employment for Victorians, but what we'd really like to see is a dedicated youth employment plan that recognises that young people have been disproportionately impacted, and without really targeted and specific intervention now, will become a kind of scarred generation and won't ever recover in their career paths. So, and you know, and that would recognise the strong connection between and underemployment and mental distress, which has become so clear this year of all years. And the last thing we'd like to see is a real commitment to youth participation. So young people being involved in powerful decision-making roles in designing and delivering this COVID-19 recovery, because we know that involving young people leads to better decisions and it makes for a more meaningful process for everybody involved. I'll wrap up just very quickly. I wanted to talk about the next piece of work that we're doing, which is connecting the investments that the Victorian government have committed to our COVID-19 recovery plan, which I've just posted a link to in the chat. Recognising that young people have been disproportionately impacted, we brought together all of the key players, including Orygen and Mental Health Victoria, to identify what actions Victoria needs to take to support young people over the next 5 to 10 years. So what we'll be doing is aligning the recommendations that we've made with the investments that the Victorian government have committed to. And we've started that process and we're very happy to see they've taken on board a lot of our suggestions. But it's just a case of, how we do those things and which bits we might need to advocate for in the next budget next year. That's enough from me, Emily. I'm happy to stick around and answer questions. Thanks so much.
Thanks so much, Seb. It's really exciting to have this concrete commitment from our state government, because I think it really shows that they value, at least monetarily, the voices of our young people. I really liked how you reflected on the silver lining of like the lack of detail, because it means that it allows for flexibility in terms of opportunities for young people to partner for like co-design, production, delivery, and evaluation. So thanks again. And thank you again to all of our presenters. You provided us with a lot to discuss. I've got a few questions that have come through. Audience members, please feel free to continue to submit your questions via the chat function. And I'll read out some names. And if you want to unmute and ask your question, that's one option. Otherwise, I can read out your question from the chat as well. We've had a question from Alex Nicole in terms of peer support. Alex, do you want to unmute and ask?
Yeah, thanks for that, Emily. So good to see so much peer support work momentum building, and thanks everyone for such a wonderful summary. That was so helpful to get that overview of particularly the Productivity Commission. I'm lucky enough to be in sort of a system redesign role, and we're looking at lots of different roles for peer support workers and how we can include them. And it's just a question that comes up time and time again, because my way of thinking is a clinical way of thinking. You know, this is what clinicians do, this is what the pathway is. And then we say, let's insert peer support workers into that. And it's just this open question of what does that look like? And so I think we continuously go back to, you know, they'll do an assessment, or they will talk about a young person's needs and then link them in with care, all these really clinical processes that are our assumptions. I'm really interested in thoughts from, you know, those who have read the policies, or just the group in general, how we make space for young people to lead the innovation in those spaces and to do it in a peer support work way, not in a clinical way.
I can talk to that. I think that's a really pertinent question, and the right question to be asking, I think, because I think one way they've tried to tackle that is through a professional association that is able to kind of set, you know, put people with a lived experience and people with experiences with training and peer work together to develop consistent standards and approaches that would provide guidance for organizations who take peer workers on, because I do think it is an issue that so often we don't know what we're doing necessarily. We've got a lot of people with who have experiences that are more clinical, or training that's more clinical, and writing the PDs and implementing the programs, and sometimes providing the training without necessarily having a really clear picture of what the role is. So I do think one of the, you know, with the Productivity Commission in mind, I think one way of tackling that is the professional association. And I think they talk about the Australian government providing seed funding and then it potentially being funded by the sector, and that might be a little bit of a worry, because you do have obviously a lot of clinical organisations, and you don't want them to, you don't want the association to have to worry about where their funding comes from, or the types of supports they need to be providing, or messages they have to provide based on who they're funded by. I think largely it requires people who have roles in peer work or the lived experience workforce to be promoted into more senior positions to provide that supervision. There does need to be a way in which services are required to provide all of the necessary training and supervision and support to that workforce needed, in the same way that we would expect a social worker or a psychologist to have adequate supervision, appropriate amounts of training, without putting our own clinical lens on things like providing a minimum standard, because we do also need to acknowledge that their expertise comes from their lived experience. And the only other thing I would add with the Productivity Commission in mind is that we do need to be really careful when they talk about the promotion of peer work, because there is some concern that the peer workforce is seen as one that is really economically viable, and that, you know, that's coming at a time where currently large chunks of the peer workforce are not provided with peer-specific supervision, peer training, and some people are entering the workforce without any supports or training in peer work at all, and completely surrounded by a clinical workforce. So it's a very good question, and I do think it will probably have to come down to some kind of requirement that anyone who hires a peer worker has to kind of take the whole load of investing in their support and supervision as well.
Thanks so much, Alex and Nick. We've had another question come through from Zorka. Seb, do you want to speak a little more to that, or?
Yeah, for sure. I've just answered it in the chat there. Zorka, your question was about the Fraser and Engage funding, which comes out of the Victorian Budget. We're very eager to see that funded again, because we know that it delivers great results for young people involved. But yeah, as I put in the chat, we haven't found any specific reference to Engage funding, which is about supporting like generalist youth work programs across the state to support young people, to do early intervention, connect with communities, and to build employability pathways. But yeah, as I said, we're following up with the department about that and hope to find an answer soon. Fraser is in the service delivery booklet on page 332, sorry. So seems to be safe this time around. But yeah, as soon as I find some more information, I'll.
Yeah, no, that's great. We were just concerned that it was sitting very late in the year with no kind of direction, no information. Even we've reached out to our funding bodies and just trying to push along a response because we do feel it's a bit late in the year to kind of plan for such a big outcome, and it's such a complex outcome considering we've now faced COVID.
100%. Yeah. Agreed.
No, that's all right. I just thought maybe you might have known something. Thank you.
All good.
Thanks so much, Sarika and Seb. Feel free to keep checking questions in the chat, guys. I have a bit of a question because I'm fairly new to all this sorts of things, and like 1,600-page reports are terrifying. So I was just wondering, with stuff like gaps in terms of the detail and directions forward, is there opportunities for like organizations to submit like proposals or campaigns for anything? Yeah, how much wiggle room is there, and what are the sort of plans for, like, say, I'll ask Seb first, sorry, and then I'll ask Viv and anyone else that's here. Like, what is YACVic's plan to do with like the PC report?
I might talk more about the budget, if that's okay, Emily, because I was just thinking, you're talking about wriggle room, you're talking about implementation kind of strategies, I suppose. I think I'll start talking about the $47.8 million for early intervention support for young people and what we'd like to see happen and what we'd plan for that. And then Viv, if you want to jump in, like, very happy for you to be part of that conversation as well. I think like the fact that the government's earmarked that amount of money is fantastic and recognises that they understand, you know, what's happening for mental health for young people in Victoria. As I said, I think it's a great opportunity for kind of collaboration on how that money is spent. My sense is the fact that there's kind of not as many details as usual attached to that funding means that the government is very eager to involve all the kind of stakeholders in deciding what happens there. So it would be around bringing young people with lived experience, people from the sector, researchers, you know, peak bodies like us, Orygen, Mental Health Victoria, like everybody around the table. And I should say, particularly young people with lived experience, because those are the voices and experiences that are most important. And then hashing it out from there. I'm not exactly sure like the timelines. I'm sure it would be sooner rather than later that happens. But yeah, I think, yeah, rather than something nerve-wracking, it's something a bit more exciting. Viv, did you want to add into that at all?
No, and just support that as being a real opportunity, I think, with that funding. And I suppose, you know, people will have heard the term the missing middle sort of discussed a lot, but I suppose, you know, this is a sort of investment that we're kind of looking for to see where the state can step into addressing that sort of gap in care at the moment for young people with more serious and complex mental health issues. The little bit of information that I have seen around that discussed it in the context of the NDIS as well, and for that it could provide support to young people who might be waiting for an assessment on their eligibility for NDIS care plans, which is also quite interesting because we know sort of through the NDIS in terms of psychosocial supports that, at least in sort of earlier data that I'd looked at, that young people are really sort of underrepresented in the numbers of people who are taking up care plans for psychosocial disabilities, and often because, again, the eligibility is around you know, needing to demonstrate a permanent disability or condition, which is sort of something that, particularly in youth mental health, where we have a focus on recovery, is something that most, you know, clinicians and workers in the space are very reluctant to sort of assign a permanent label to these sorts of health experiences. So these young people are missing out on care. So I think that there's lots of opportunities there. in terms of the sort of the next steps with the Productivity Commission and where we might see gaps and opportunities into the future, Emily, as well. I mean, yeah, absolutely, 1,600-page report and it still can't cover anything. It was huge. I mean, and the scope of that piece of work was in that it encaptured social determinants for mental health as well as a mental health service system. You know, they're never going to be able to come up with all the solutions, but I think there are lots of opportunities to sort of read through the report and look to where it's identified a need. It's been able to describe that with research and data that they've been able to access. We can utilise that to then look to both, not just the Australian government, but, you know, Victorian and other state and territory governments as well, to make the case for investment in various programs, which we believe will actually meet that need. If it's, you know, not been clearly described in the recommendations, then as Dave was saying, there's the opportunity for us to step in and describe what that should look like. So, and provide the detail and the roadmap. So yeah, I don't know if that answers your question, Emily.
I'll just add,
It definitely does.
Sorry, Emily, I'll just add to that the government does respond to the PC report. I'm not sure on the timing, but seeing the government's response and seeing where they're going to lay their priorities would also show where that opportunity might be for people to then be proposing more of the details on where to go, how to go forward.
Thanks so much, David, and Viv and Seb as well. I think Andrew has a question.
Yeah, it was actually sort of already asked, but I was thinking just along the lines of, yeah, where to next for the Productivity Commission, and in terms of what specific actions we might take as organisations in the sector who have specific recommendations or actions that they want to support. Yeah, what can organisations and people be doing to contribute to the success of or seeing those recommendations implemented? Oh, Viv, did you want to?
That one, what we can do. Yeah, I mean, I think there's a couple of things. One from, from our organisation at Orygen, we're absolutely keen to, as I was just describing before with Emily, to sort of look to pick out those things, like probably on the last couple of slides that I presented as well. We're really interested in the tertiary education space as well. We think there are lots of opportunities there. So it is around, I guess, again, continuing in our, either in the communications that we've put out through our policy team or through our advocacy or government relations, to continue to elevate that particular issue that was identified in the Productivity Commission and come up with some opportunities to assist the government in implementing the recommendations. I think the governments will be thinking about that now. So they will be looking for what some of the mechanisms and structures and funding might be to actually implement some recommendations where they support them and where they can see that there is, that the timing is right and that the rationale is there. I think in terms of as a collective, it's also just good that, I'm not entirely sure whether there's an opportunity with the community of practice as well, just to be able to create another opportunity to have a discussion or provide some thoughts across the network around things that resonated with people, where they sort of saw there were some opportunities to sort of pick up findings from the PC report, and I guess look for ways that we can work together in sort of either talking to governments or advocating more broadly around their implementation or uptake. So that's probably more one for Andrew and Luke and Seb about sort of what mechanism might be able to sit behind the community of practice to keep the conversation happening.
That's super exciting, because I feel like this group of people, it's a wealth of knowledge. So it'd be really cool if we could collaborate here. Karen's just said that there'll be a consultation process run by the government to feedback our thoughts. And Melinda has also said that the Bridge Youth Service in Shepparton would be keen to collaborate on the early intervention response. I think that's for Seb. So yeah, thanks so much for that, guys. I do have one, sort of struggling with this question in my head, and it's for you, David. With the sibling peer workers, I was wondering if you could dig into that a bit more, whether they said anything specific about that, because my understanding of family peer workers is that there are people of lived experience of caring for someone in their family with a mental health experience. And I thought that family peer workers were sort of open to anyone in the family. So I thought that encompassed siblings, but you pointed out, and it's very obvious to me that all the family peer workers that I know are parents. Yeah, and I find that quite odd. I'm wondering if that was intentional or whether there has been like a separation in your experience.
Thanks, Emily. Yeah, the idea of a sibling peer worker was one of the policy solutions out of the policy report I mentioned. And what it goes to is it could fit within the family peer work support model or role. It would be someone whose experience was as a sibling rather than as a parent or carer. The policy paper recognised that the resourcing and initial demand for such a role would be quite small until awareness was increased and greater. So suggested starting with, say, there might be one person in that role who worked across a number of organisations or services. And then as that awareness of that role increased, if there was demand, then more resourcing could be put into it. But no, it's not something the PC report covered, but it's something that just a gap that's been identified. And also Siblings Australia is one organisation that works in that space, but doesn't have a lot of resourcing at this stage, and any advocacy around that by other organisations just helps bring attention to the potential for such a role.
Thank you so much. I might just open up to the floor and see if anyone has any other questions. Otherwise, I have one more. Okay, Nick, sorry. With the Peer Worker Association, was that a suggestion from the PC for someone else to implement, or was that something that they plan to push?
Yeah, well, I suppose their recommendation is that the Australian government provide seed funding to a body. I know the National Mental Health Commission commissioned a report that had some suggestions as to how they might set up that model, and that they're probably really well placed to help connect a range of lived experience organisations to come together and develop that model. I'm not quite sure what the implementation of that looks like, but it is something that people have talked about for the last couple of years. I assume that my assumption is that the Productivity Commission's advocacy kind of ends with the report, and it's for the government to kind of take that on board and pick it up.
Cool, thank you. We're running out of time, so we might need to close the questions there. I just want to say a really big thank you to all of our presenters for sharing their time, knowledge, and experiences today. We really appreciate it. And I want to ask everyone that attended and asked questions too. Before we finish, I'd just like to remind everyone that if they would like to take part in further webinars, they can join the community practice by accepting the invitation to join that will shortly be sent around. Finally, if anyone is feeling as though they need some mental health support, please use the contact details that are being shared in the chat function now. We also encourage everyone to take some time this afternoon to practice some self-care and be mindful of their mental health. I'm definitely going to go eat some food, which is me taking care of myself. Thank you again for joining us. We hope that you enjoyed the session and look forward to seeing you next time.